Yes, so I'm Dr. Aditya Jindal, and I'm a DM Pulmonary Medicine from PJ Chandigarh. Presently, I'm practicing in Jindal Clinic Sector 20, Chandigarh, as a consultant pulmonologist, intensivist, and sleep specialist. Yeah, so pulmonary medicine is a rapidly evolving branch of medicine today. It has been changed by the addition of subspecialties like intervention pulmonology and especially sleep medicine. It has come from being the dull backwaters of medicine to one of the sort of hotspots of research and clinical practice nowadays. Especially if you talk about the pick two diseases like COPD and sleep disorders. Like COPD, a lot of new research has come up in COPD, as we all know that COPD has a high prevalence in India, especially related to smoking, environmental air pollution, and indoor air pollution. And the global burden of disease study has estimated that COPD would be among the top 5 causes of mortality in the world in the next 10 years. Also, sleep disorders, a long under recognized branch of medicine, have been recognized. They have been so in the sort of Western world for quite some time, but it's only recently that Indians and Indian doctors in general are starting to understand the importance of sleep disorders. A lot of work is still to be done. The incidence, the prevalence of these diseases still to be discovered in India, but roughly right now around almost 5 to 10% of all Indians are supposed to be suffering from sleep disorders. Yes, so being a pulmonary specialist in India has many challenges. One is of course that the specialty has a very broad base of education, and there are a lot of degrees, a lot of people who are actually practicing pulmonary medicine with varying levels of excellence and I would say skill. The other challenge is the public perception towards treatment and diseases. COPD, for example, there is no vernacular word for COPD in India, so it is confused with asthma. And instead of patients of asthma are treated as COPD, while patients of COPD are treated as asthma. So that is a very big challenge, and patients in whom inhalers are prescribed for COPD will think of the prognosis of COPD, and it's very difficult to get them taking these inhalers. Second is the second challenge, and especially for also for sleep medicine. So people really don't consider sleep disorders to be a disease as such, and they mostly think that it's more of a social habit, like patients who have snoring and who find it difficult to sleep and have excessive daytime sleepiness. They are ridiculed by their families and friends, and they often do not come to the physicians for diagnosis. Yeah, so first of all, sleep medicine needs to be actually recognized as a separate subspecialty and needs to be developed further. There is a need for a national society for the study of sleep medicine and promotion of the study of this discipline in medical colleges and universities. Right now, it is more of a backwater, and people who are the only people who actually practice sleep medicine are the ones who are actually really interested in it. So we don't have a broad base. The second is the need for public education. A lot of public education on what sleep disorders are, what the problem, how to treat them. As regarding COPD, I think one of the major steps that has been taken is the restriction in smoking by the past. However, this further action needs to be done to really clamp down on this menace, and the other would be to really reduce the air pollution that is happening nowadays. And if we look at the state of North India in the last month or so, the stubble burning has led to such a worsening of symptoms of these patients, whether contributing to the chronic burden or to the acute worsening of this disease, that really needs to be taken care of.